Okay, you're good.
Hi, I'm Nicole Hampton, and I'm an exercise physiology major.
I'm Madison, and I'm a public health major.
And I'm Kayla, and I'm a public health major also.
Our presentation today is on mononucleosis.
The etiology of mononucleosis. It is often referred as a kissing disease or mono. It is considered a virus. Mononucleosis is caused by the Epstein-Barr virus. It was discovered in 1964 by Michael Anthony Epstein and Yvonne Barr. An interesting story about that was that Yvonne Barr was actually studying to get her PhD to receive her PhD while she discovered the virus. So I thought that was really interesting that she discovered the virus while not even having her degree yet. Next slide. It is a member of the human herpes virus 4 family. The morphology is enveloped. The viral genome is a double-stranded DNA.
The reservoir for mononucleosis is humans, and the virus is usually carried by healthy people that were previously infected. And this virus is most common in teenagers and young adults.
The signs of mononucleosis include fever, swollen lymph nodes that are usually in the neck and the armpits, swollen tonsils, a skin rash, and a soft or swollen spleen. It will also include a positive blood test looking for the Epstein-Barr virus. The symptoms include fatigue, sore throat, headache, chills, body aches, and a loss of appetite. And when you have mono, you probably won't have all of the signs and symptoms. You'll probably only have a combination of a few of them. The most common symptom associated with mono is fatigue. The virus that causes mono is found in the saliva, mucus, and tears of the people who are infected. So you can contract the disease by ingesting or coming into contact with the saliva, mucus, and tears of someone who has mono. This can occur through kissing, sharing food, and sometimes even just drinking out of a water fountain. It is very contagious. Someone with mono is contagious before they start having symptoms, and they stay contagious for many months after their symptoms go away.
So some of the testing for mono. So I work in a medical laboratory called ARUP. There we do all kinds of medical testing on different specimens and sample types. As I started this class, and especially this project, I started noticing the types of tests that we run. I work in the part of the lab that processes the specimens. I get samples from across the country and some outside of the country, and order the test for the sample and then send it onto the lab for testing. I want to talk about the different types of testing that can be performed to diagnose mono. Diagnosis can be based on symptoms, the finding of atypical lymphocytes, which are the earliest sign of infection but disappear with the resolution of the disease, or the presence of lymphocytosis, which is mononuclear cells consisting of 60 to 70% of white blood cell count with 30% atypical lymphocytes, or heterophile antibody, an antibody to viral antigens. Heterophile antibodies result from nonspecific mitogen-like activation of B cells of EBV and the production of a wide variety of antibodies. The heterophile antibody response can usually be detected by the first week of illness and usually lasts for as long as several months. Heterophile antibody testing is excellent in adults, but not as reliable in children. Next slide. The monospot is a widely used test for the detection of heterophile antibody. Monospot testing is performed by taking a fingertip sample. The health professional taking the sample will clean your hand with soap and warm water or an alcohol swab. Massage your hand without touching the puncture site. Puncture the skin on the side of your middle finger or ring finger with a small instrument called a lancet. Wipe away the first drop of blood. Place a capillary tube on the puncture site and collect a small amount of blood. Put the gauze pad or cotton ball over the puncture site as the tube is removed, and then put pressure on the site and then put on the bandage. This test is done within an hour and is performed in a lot of clinics. Positive testing is usually for heterophile antibodies include the IgM antibody to the VCA, which is viral capsid antigen, the presence of VCA and the absence of EBNA, which is the Epstein-Barr nuclear antigen, or the elevation of antibodies to VCA and early antigen. The finding of both VCA and EBNA in serum indicates that the person had a previous infection. So the treatment and prevention for mononucleosis, there is no vaccine. So the only way to really protect yourself from getting mono is to avoid kissing, sharing drinks, or personal items such as toothbrushes with people who have mono. Some over-the-counter medications can be used to help minor symptoms like the fever, fatigue, and for major symptoms, a doctor might recommend specific treatments for the organ systems that were affected. So to control it, once again, over-the-counter medication can be used for the fever to keep that down, but it's best to stay hydrated, get a lot of rest, and avoid full contact sports because the spleen often becomes enlarged.
Some of us might have already had mono without even knowing it. According to a column published by the University of Washington, many college students are also immune to mono because they've already contracted the virus without realizing it. Zero prevalence studies, which test the blood of individuals to determine if they've already contracted certain diseases, have revealed that anywhere from 30 to 75% of incoming college freshmen already had mono before coming to college. This percentage only rises as people age. Another interesting fact I found is that it says that about 95% of the population has been exposed to the virus by the age of 40, but only 15 to 20% of teenagers and about 40% of exposed adults actually become infected. Can we die from mononucleosis? Although death by mononucleosis is rare, it can happen, especially if there are other health issues. I was Googling about the disease and I came across an article about a girl that died in Maine. She had contracted the virus and she ended up dying last month, actually. I'm sure she had other health issues, but mononucleosis was named as the primary that she had that caused her to die. According to the World Health Organization, there were only 78 recorded deaths associated with mononucleosis. Next slide. And there's other causes as well. Approximately 85% of the cases of the disease are associated with the Epstein-Barr virus. Other cases are caused by the cytomegalovirus or human herpes virus 5.
So this is an experience with someone who had mono. Amber was a college freshman when she first started experiencing symptoms of mono. She thought she just had a bad cold, but weeks later she was still sick. She was trying to keep up with her busy schedule, but her constant fatigue made it very difficult. She would go to class and do her homework quickly and then go to bed just exhausted. She finally decided to go to a doctor and had some blood tests done, and the blood tests revealed that she did have mono. Her doctors gave her some medicine to help her with her symptoms so she could get back to her schoolwork. She was sick for another few months, but eventually she started to feel relief from her symptoms. Though the Epstein-Barr virus does not leave the body, you eventually will no longer be contagious and become symptom-free. Amber is now healthy. She doesn't have any symptoms, and she's serving a mission for the Church of Jesus Christ of Latter-day Saints in Boston, Massachusetts. And you would never be able to tell that she had mono. This is another person who experienced mono. I began experiencing symptoms of mono shortly after I had my first child. I blamed my symptoms on the sleep deprivation that comes with taking care of a newborn. Almost a year later, so this person had fatigue, and they also had some body chills and some body aches. Almost a year later, I had a blood test done. The blood test revealed that I had already been exposed to the virus.
So this is another experience with mono. I had my roommate write down her experience, and so this is her words. It says, "A couple of days after kissing someone, I noticed a serious sore throat and some fatigue. I could feel that my lymph nodes were incredibly swollen, and I was just hoping to pass the illness off by getting some rest. One night while I was making dinner for myself and while I was on the way to eat on the couch, I put my dinner on the counter and laid down on the kitchen floor and fell asleep right there. The next day I decided to see the clinic, and I was just hoping that it was just strep, so I could take some antibiotics and be better soon. The strep test came back negative, and the doctor recommended the mono test. Unfortunately, that came back positive, and he gave me some antibiotics and told me to rest and drink liquids. After a few weeks, I was able to get back to my normal routine without many issues."
These are our works cited.